My name is Clare Armour and I am the Interim Delivery Director at OneCare. OneCare is an organisation that represents over 80 practices across Bristol, North Somerset and South Gloucestershire. We have three main strategic aims. So one is to help practices really thrive and become resilient. The second is to help them work at scale and to introduce innovation and share new ways of working. And the third is to act as the provider voice for general practice with the wider system. OneCare is unique. We represent such a large and diverse number of practices across Bristol, North Somerset and South Gloucestershire. And we're in a good position to help all of them, both in terms of helping them to stay resilient, helping them to learn from each other, helping them to innovate, but also enabling them to stay small if they want to keep their own culture, and to really deliver the best care that they can for their patients. All practices, apart from one, are members and shareholders of OneCare. This gives us a brilliant opportunity to share ideas across all the different practices and also to really act as that provider voice for them at a system level in the healthcare system. OneCare is helping with the challenges that general practices are facing. So, for example, we were able to recently bid for clinical pharmacists to work in practices, which is obviously going to help everybody. It gives clinical pharmacists a fantastic career opportunity, but it also gives practices additional resource and additional skill mix that they can use for their patients. My job is very, very varied from day to day. I get to work with people from all the practices across the patch, which are fantastic people, and also working with the other members of the health system, for example, community services as well. I think general practice does have quite a number of challenges ahead at the moment, both in terms of having enough resource to be able to deliver their services, to be able to manage the agenda around moving more care out of hospital settings and moving it closer to home, but also about staying resilient and keeping their own culture and their own uniqueness at a time when people are talking about working at scale. If I wasn't working for OneCare, I think I would still be working in this health system in some way or another. But I love working at OneCare. I've been there over 2 years and it has been a fantastic opportunity for me.